One of the famous and important medications in the treatment of rheumatoid arthritis is a medication called Methotrexate, whether weekly injections or weekly dose of tablets. And in spite of the fact that there is quite a long list of medications for the management of rheumatoid arthritis, and most of them are actually newer than Methotrexate, yet Methotrexate still ranks high on that list. In most international guidelines, it is one of the very first medications that we prescribe to patients with rheumatoid arthritis and also some other autoimmune arthritis disorders. Why? Because, one, it is effective in a good percent of patients. Of course, not in all patients. No medication in the world is good for all patients, but it is effective in quite a good percent of patients. Two, if you suffer of side effects with the use of the low-dose methotrexate that we prescribe in rheumatoid arthritis, and of course those side effects will happen also in some and definitely not all patients, those side effects are mostly not serious at all and are totally under control if we only decrease the dose or withhold the medication for a couple of weeks. That's all. Three, in addition to being able to control the disease activity, methotrexate is also effective in preventing some of the long-term complications of rheumatoid arthritis like atherosclerosis of the blood vessels. This is a long-term complication that can happen with any chronic inflammation in the body that has been there for years and was not well under control. It is more likely to occur in patients who also have diabetes or high blood cholesterol. Number four, Methotrexate is a really cheap medicine, especially when you compare its price to the other non-biological medications or, of course, the biological medications that we prescribe for patients with rheumatoid arthritis. For all those reasons, Methotrexate is keeping its high rank in the list of anti-rheumatoid medication. But when we prescribe methotrexate to a patient with rheumatoid arthritis, we face several problems, and this is the reason why we made this methotrexate videos series. One of those problems, which is the topic of this video, is that other rheumatoid patients who have been prescribed methotrexate before and who suffered of side effects from methotrexate, the most famous of which are nausea and stomach troubles, and that's why those patients, they don't like methotrexate. Those patients, they warn the patients who have been just prescribed methotrexate of the side effects, and they make them really panic. And as a result, some of the patients prescribed methotrexate feel so awkward about it and they don't want to start using it. They don't want to try it even. In this video, I have something very important to tell to the patients who have just been prescribed methotrexate for rheumatoid arthritis or psoriatic arthritis or other autoimmune arthritis, and also I have something no less important to tell to the patients who don't like methotrexate, who keep on making those warnings to other patients on social media. I'm Dr. Hatem Eleishi. I'm a professor of rheumatology at Cairo University in Egypt. I also provide online consultations and patient education sessions for patients with arthritis. This is my English channel for patients with arthritis. Please don't forget to click subscribe. I publish videos about everything that is related to arthritis conditions, how to diagnose them and how to manage them. Any medication that we prescribe to manage a given disease should fulfill two important criteria. First, it should not result in serious side effects or not serious yet really troublesome side effects. And second, it should, of course, manage the disease, control the disease, and improve the symptoms of the patient. Methotrexate nicely and perfectly fulfills those two criteria in like 40% of patients to whom we prescribe this medicine. And in those patients, methotrexate is a wonderful experience. Please, Barbara, don't look to me like that. If you suffer side effects and you don't like methotrexate, this was not the experience of Laila and Peter and John. They love methotrexate and they feel very grateful to it. Even some of the patients who love methotrexate, they feel better on the day of the methotrexate dose, as if it works as a painkiller for them also, not just a medicine to control the disease slowly over weeks. And in 30% of patients, methotrexate would cause side effects. The most common are nausea and maybe vomiting, disturbed stomach, maybe mouth ulcers, maybe some falling of hair also. Those more famous side effects are not serious, but can be really troublesome for the patients who will get them, of course. Sometimes a patient just seeing the methotrexate box or just you mention the name of the methotrexate in front of them, they feel nauseated. In such patients, if methotrexate is controlling the disease well, it becomes a problem for the patient and the doctor whether to bear the side effects and continue the methotrexate or whether to shift to another medicine. It all depends here on to what extent those troublesome side effects are troublesome to the patient, and it also depends on the availability of other treatment options for the patient. Sometimes you already lost other cards, or sometimes other cards are so expensive. But if methotrexate is not controlling the disease, the decision to stop it and shift to another medicine is a straightforward one, of course. Lastly, in the remaining 30% of patients, methotrexate does not cause side effects and also does not cause any effects on the disease. It's a useless card for the disease. So we don't need to continue methotrexate here and we shift to another medicine, of course. Now, what is the very important value of this classification? 40%, it's a wonderful experience, too good to be true. 30%, silly side effects. 30% no side effects and no effects also over the disease. The value is that, first, if you are a patient who has just been prescribed methotrexate by your rheumatologist and you are worried of what other patients who hate the medicine are telling you about it on social media, you will realize now that what you read was the experience of only those who dislike the medicine. It is not at all the experience of everyone who has been prescribed the medicine. This means that if you start methotrexate, you have a likely chance to discover that you belong to the group that benefits from this medicine without any side effects, the group of patients who love the medicine. And worst scenario, if you are going to be one of those patients who will use methotrexate and get those silly side effects of nausea and stomach upset, you will never know this except if you start to use it. And if this ever happens to you, they are not serious at all, only disturbing or irritating for a couple of days, and you can simply stop the medicine and that's it. It's over, no problem. The second important value for this classification is for you to realize that if you are a patient who really dislikes methotrexate because of any side effects that happened before with it, to realize that this is your experience only and not everybody's experience. It is not the experience of all other patients who used it before or will use it later. It's only you and some other patients. This means that if you keep generalizing your experience, your body's response to the medicine, to all other patients in this world, and if you keep warning others of the medicine, maybe you will be a reason why a patient who might really benefit from this medicine, that she will never use it, will never even try it to discover that it was good for them. This is not fair for them. In light of what I have just clarified in this video, I think this is even not a responsible thing to do at all. Conclusion? Dear rheumatoid patient who has been prescribed methotrexate, start your treatment and don't listen to others or ask anyone other than your doctor. He is the reliable and unbiased source of your medical information. Dear rheumatoid patient who is using methotrexate but is suffering of some nausea and other silly side effects, please get back to your doctor for other alternative treatment options that hopefully will be more suitable for you. And always remember not to generalize your body's response to other patients who probably have different bodies and hence different genetics and different responses to medicines. Thank you for watching. We will meet soon in other videos. The next couple of videos will also be about methotrexate. Don't forget to subscribe to my channel. If you like to book an online meeting with me, kindly contact my assistant on the WhatsApp on the screen. Patients mostly consult me for a diagnosis of their symptoms or for extended patient education sessions and question and answer sessions about their particular medical problem, their prescribed medications, and needed advices and instructions that are tailored to their medical problem. See you soon. Till then, take care. Bye.